So the claim that lithium has a narrow therapeutic index is a false claim. So my claim then is that lithium is the safest psychiatric drug because it's dosed too high, the reason people think it's harmful, but at uh, the doses that you need and the levels you need for most mood illnesses, unipolar depression, type 2 bipolar, even some type 1 bipolar, and mood temperaments, the levels of lithium would be half of what we generally use. And if it's dosed once a day, we will reduce our long-term harm to less than 1% with 20 years or longer of treatment with real, meaningful, clinically relevant kidney disease, which is very small. In other words, 99% of people will have no problem with it. And you could even dose it at tiny levels that are over the counter that are undetectable and still cut your suicide rate in half and reduce your dementia rate based on these studies. If they're true, and I think there's good reason to accept them based on this is the evidence that we have. So the claim that lithium has a narrow therapeutic index is a false claim. It does not need to be dosed at 0.8 to 1.0, and it is false to say that. And so it really is just a wrong idea to say that lithium is unsafe, has a narrow therapeutic index, and that's a reason we should be worried about it. In fact, at these low levels, it is quite safe. So it's not as unsafe as people claim. And the nuisance side effects, like I said, are almost not present at all, especially at these medium to lower levels.